And we are live. Excited. Today is going to be a good one, talking about the Estrobolome. But before we get into that, let's do some introductions and some quick disclaimers. My name is Cole Seif. I'm one of the co-founders of MedMatrix, in charge of patient education. And I'm joined with the spectacular Dr. Rose. Dr. Rose, while we're waiting for people to roll in here, why don't you give a kind of brief overview of your licenses and experience, especially around the Estrobolome?
Okay. My name is Sasha Rose. I am a naturopathic doctor, and I'm also a licensed acupuncturist. I have been working with women's health for 20 years. I've also been working a lot with people in general, including women, on digestive health and gut health. And I am fascinated by this topic of the estrobolome because it really, in a very real, functional way, ties these two things together, kind of our estrogen metabolism as well as our gut microbiome and gut health. So for me, this is kind of like the joining of two topics that have interested me for quite a long time.
Okay, great. So before we get into it, quick legal disclaimer: what we're talking about today is not medical advice. This is for educational purposes only. So let's set the foundation here. What is the Estrobolome?
Yeah, so the estrobolome, I kind of think of it as the estrobiome because it's a specific part of our gut microbiome. So organisms or microbes in the gut that are in charge of estrogen metabolism. And kind of the recycling of estrogen, how much exposure the body has to estrogen. So technically, it's a group of gut microbes.
Okay. Why is that important? Why should anyone care?
Why should we care?
Yeah.
Because if there is an imbalance in that aspect of the microbiome, if there's inflammation, if those microbes are not if there's too many of them, if they're just not in the right balance, if there's a specific enzyme that we'll get into later, if that is too high, then there's going to be more estrogen in the system than is optimal. And that is going to contribute to things like PMS, PMDD, which is a more severe form of PMS. It's premenstrual dysphoric disorder, postpartum depression, really heavy menses, really heavy cramping, acne. And there's even a link to our neurotransmitter balance, including serotonin, dopamine, GABA, and that's going to directly affect our mood. So things like depression, anxiety, mental health in general. So it's pretty crucial both to hormonal health, neurotransmitter health, and it's really it really brings in the liver detoxification pathways, the gut microbiome, and estrogen, and how well estrogen is kind of broken down, recycled, eliminated.
Okay, gotcha. Why is it important to, I guess, let's set some more groundwork here. What is estrogen metabolism and why should anyone care about it, especially a woman?
So estrogen is made in a woman who is pre-menopausal. So her ovaries she's still cycling every month. Estrogen is made in the ovaries. It's also made somewhat indirectly in the adrenal glands. And there's actually even some estrogen made in fat tissue.
Okay.
So we need estrogen, right? We need it for fertility. We need it for bone mineral density. We need it for mood regulation. Estrogen really actually can be like both relaxing and energizing when it's in the right amounts. Women who cycle will usually agree with the statement that sometimes their mood is the best. They feel most like in control of their lives and their emotions. They feel energized right around mid-cycle. So, like in a 28-day menstrual cycle, really kind of like right before ovulation, around ovulation, that's often like mood-wise when a woman's going to feel the best. That's when your estrogen is kind of the most stable. So we need estrogen from everything from our joint and connective tissue health to mood regulation to our skin health. I mean, it's crucial, right? So, however, when there's too much estrogen in the system, that's when you get some of those conditions that I mentioned earlier, like PMS, PMDD, acne, depression, like it's called estrogen dominant symptoms. And so really it's about the right amount of estrogen and a woman's level of sensitivity to fluctuations in estrogen.
Okay, so women who have, because I guess define PMS. What is PMS?
Premenstrual syndrome.
Okay, so essentially it's like PMS becomes a problem when it affects your quality of life. Like your PMS is so bad that like it almost ruins your life. I mean, I've heard women come to practice who've experienced that.
Yeah.
Okay.
So there's every woman who again is cycling, there's a premenstrual time, right? It's like the week or so, it can be 1 to 2 weeks before a woman actually starts her period. Mm-hmm. And some women skate through that. They don't know their period's coming. They really don't feel anything different than normal. A lot of women feel everything from a change in their digestion to really anxious, really depressed, really lethargic, heavy breasts, tender breasts, low energy, like everything is just off. And for a lot of women, it's not just like for the couple 2 days before she bleeds. It can literally be like 2 weeks before she bleeds. Like it's significant, like half of the month she's debilitated. Okay. So that's PMS. So it can be both emotional and physical.
Gotcha. So how do we fix that with estrobolome? How do we fix PMS with estrobolome?
So it's really this connection with the gut. There's 3 pieces. There's the estrogen metabolism. There's the liver like the liver pathways or liver detoxification, and the gut microbiome. So the quick answer to your question is we address gut health and liver health. And if we optimize that, then her estrogen levels should be more stable, and her sensitivity to the estrogen in her body should be more stable, so that there's less of the fluctuations. There's not too much and not too little estrogen. And so all of those things, physical, mental, emotional, should be not, again, relative throughout the cycle, should be not these like huge peaks and valleys.
Okay. So what's the connection between constipation, right? Not pooping, and bad PMS symptoms, depression, all those like estrogen symptoms you were talking about?
So oftentimes, in a healthy individual, female who is having regular bowel movements, the connection here is that the estrogen is produced again primarily by the ovaries, and it locks into the estrogen receptors throughout the body, does its work, and then goes to the liver, like in the blood, travels to the liver, gets basically conjugated, like kind of bound up by the liver into a form that can then pass into the gut. And that's where the microbiome, that's where the bacteria is. There's a specific enzyme called beta-glucuronidase. And if that is in the right levels in the gut, that's produced by the gut microbiome, then the estrogen metabolites stay in their conjugated form. They pass out through the stool and they're eliminated. Now, say she's not eliminating, say she's backed up, then there's a higher likelihood that beta-glucuronidase enzyme is going to be elevated, and it's going to basically be deconjugating the estrogen. So it's going to undo the work that the liver did. And now you have estrogen available again, and it's going to basically be recycled once or twice. So rather than kind of getting bound up and passed out through the stool, it's in the system longer than it should be, and exposed to estrogen receptors. And then you get, again, all those symptoms that I mentioned with premenstrual symptoms, as well as, mostly.
Okay. Gotcha. So you go to a conventional doctor, you're having maybe depression, acne, constipation. There's an issue with the estrobolome. Do they even address that?
No, definitely not. And I think that the term estrobolome is new to me. Like, I knew about the connection. I knew about the importance of liver detoxification. I knew obviously importance about gut microbiome and estrogen metabolism, but kind of like tying it together with this term, I think is relatively new and certainly not acknowledged or understood within conventional medicine. So conventional medicine, again, we often talk about how things are very compartmentalized in conventional medicine, as opposed to it's not a holistic medicine. It's not looking at the whole person and kind of making the connections between the gut and the mental, emotional health and your periods, right? It's all separate. It's the gynecologist, the therapist, the psychotherapist, and then the gastroenterologist. We are kind of stepping back and we're looking again at how these really are tied together. So, there's way more to do for an individual, like looking root cause wise, peeling away the layers, than an antidepressant, oral birth control, and Miralax.
Okay. Gotcha. What happens when you kind of cover up those symptoms with what you were describing? Like, I imagine you see this pretty often.
Yeah, I mean, that's basically what it is that they're covered up. So some women are not going to respond well to oral birth control. It's going to make things worse mood wise, right? Sometimes it will help, but it's certainly not addressing the root cause, which is really balancing the gut microbiome, making sure that the liver is doing its job in terms of kind of doing that conjugation piece of the estrogen. And it's just adding in, basically, like birth control is just adding in more estrogen. It's not figuring out what's happening with the existing estrogen. Is it getting metabolized correctly? Is it getting eliminated correctly? So over time, either it's those quick fixes. They might help. They might help the symptoms, but they're not getting to the root. And usually it's not sustainable. And it's, the gut issues are still going to be there. It's just going to kind of snowball into usually other aspects of the woman's physiology.
Sure. Okay. So with the rest of this webinar, should we take it more in the direction of treating, like actually fixing the gut? Because it sounds like, okay, woman comes in with an estrogen dominance problem. You're really going to be looking at the gut, right?
I'm going to be looking at all of it. Yeah. Okay. So we're going to be looking at, so the other thing that I also want to make sure of, so we're going to be looking at all of it. We're going to be looking at hormone levels. We're going to be looking at, ideally, what does her gut microbiome look like? What's the level of inflammation at the gut level? And, how well does it seem like her liver, we can check her liver health, and we can kind of also just indirectly glean how well she's kind of detoxifying, if she has other signs or symptoms of not really detoxing adequately. Like acne can in addition to kind of estrogen dominance, that can kind of be a sign that you're not really detoxing well. So we're going to look at all of those aspects. But the point that I wanted to make was that it's not necessarily that a woman like her estrogen is too low or too high. It can often be the fluctuations in estrogen that cause issues. So it can be, if you look at over the span of a woman's life, it's often like during a month when she's cycling, it's often the drop of estrogen, or it's at its highest around when she's ovulating, and then it drops between ovulation and menses, and that's when the woman is most symptomatic. After a woman has a baby, the postpartum period, her estrogen is really high during pregnancy, and then there's a sudden drop with childbirth. That's often when women can be to the point of suicidal with postpartum depression and anxiety.
Wow.
Perimenopause, it's the drop and the fluctuations in estrogen. She might still be she is still, until she's actually menopausal, her ovaries are still producing estrogen, but they're fluctuating, and there's a tendency for there to be less. And so all of these things, whether it's the monthly period right after a baby, and then actual perimenopause, those are often the hardest times in a woman's life.
And a lot of this is driven by estrogen, just like the way estrogen really affects the way that a woman.
It is. It's basically because estrogen can both be. It can. It kind of has this direct impact on neurotransmitters. And so when estrogen is out of balance, you're going to see more inflammation in the gut, and that's going to affect your serotonin, which is like your relaxation neurotransmitter. So 90% of serotonin metabolism is in the gut. And if there's inflammation, if the estrogen is out of whack, then your serotonin is going to be out of whack.
So how does estrogen, that's important. How does estrogen affect our neurotransmitters? Like, how does it play such a key role in just your psychological, just well-being you feel?
So it's kind of it's like it modulates neurotransmitters. So there's estrogen receptors in the brain, and if when there's a stable level and a decent level of estrogen, it's basically going to increase serotonin production and receptor sensitivity. Optimal levels of estrogen are going to support dopamine, which is like your motivation, that kind of reward and mental focus part of mental health. It's going to enhance GABA activity, which is more like your relaxation, anti-anxiety. There's this other I guess it's a neurotransmitter. It's called brain-derived neurotropic factor, or BDNF, and that's responsible for learning, memory, emotional resilience. So again, if you think of estrogen as kind of being a regulator of all of those neurotransmitters, and when it's stable, there's going to be mental clarity, emotional regulation. They're going to feel like they can handle stress better. So when, as I said, like when it kind of makes sense then that when there's that rapid drop in those, again, whether it's the premenstrual, postpartum, perimenopausal, you're more likely to get things like irritability, anxiety, depression, brain fog, poor focus, like things that I'm sure you hear when you talk to new patients calling in all the time. Like those are female patients, like those are super common.
So let's talk about fixing that. Like, what, I don't know if you have an example of like a recent patient you saw. Like, how did you actually help them take control of this and balance their estrobolome?
Yeah. So, well, I ask everybody about gut health and how regular their bowel movements are. So, let me think of a very specific person. The way that I usually work with people is that I like to work on several systems at the same time. So it's just my style is that I usually am wanting to work on the root cause while I'm also providing things that I know are going to help make them feel better today. If possible, I don't really want my patients to have to wait 6-9 months before they actually feel better. So I can't think of a very specific patient, but because this happens, I think more like with most perimenopausal women that I work with. So this is a hypothetical person, but it's a very common scenario. So woman who is 45 tends towards constipation. So what that means is that it takes a lot of work for her to have a bowel movement every day. She's often bloated, meaning doesn't really matter what she eats. She's just kind of bloated. And she has to like really hydrate really well. Whenever she travels, she has a hard time going to the bathroom. She kind of needs that cup of coffee in the morning to have a bowel movement. So her tendency is to not really go that often.
Mm-hmm.
She's still cycling, and the 10 days before her period, it's miserable every month, right? Like irritability. She can't stand the sound of her husband chewing. She can't sleep. She is both depressed and anxious. Her breasts hurt. She feels like she's like even more bloated than usual. Everything's just off, right? And she gets her period. Things are better. First half of the her menstrual cycle is pretty good. Often this hypothetical patient is often on Wellbutrin or another kind of antidepressant, and she feels like she's not really sure if it helps. She's been on it for 20 years. She is kind of afraid to go off of it, especially because of how she feels premenstrually, and she's just kind of tired of feeling this way, right? Like kind of not herself. So my suspicion is that basically there's an imbalance in the gut and in the estrobolome, and that she is not really metabolizing estrogen well. And that one is that she's perimenopausal, so her levels are fluctuating, and she's not really kind of handling that estrogen, the estrogen that is in her system. She's not really handling it well, largely because of that gut environment and the fact that that the levels are just changing really kind of erratically throughout the cycle. So we're going to bring in some things to help her have regular bowel movements. That might be dietary. That might be increasing dietary fiber. That might be eliminating certain foods that might be constipating for her. For some people, it's dairy. For some people, it's gluten. And for some people, it's other things. Sometimes that takes a little bit of trial and error. Maybe we'll do some magnesium. Maybe we'll do some insoluble fiber. Basically get her to a place where she is going more regularly. We're going to support her liver, right? We want to make sure that her liver is doing its job in terms of conjugating the estrogen and getting it ready to be eliminated through the stool. So there's a really old-fashioned tool called a castor oil pack, and that's a topical application of castor oil. You do it actually on top of your liver. I'm happy to kind of share that patient handout with anybody who's interested. It's something you can just buy the supplies at a health food store or online, and it's a really safe, healthy way to kind of promote healthy liver detoxification. So we get that moving, and maybe some additional nutraceuticals, botanicals that are going to support the liver. Mm-hmm. And then we work on stabilizing her estrogen. So maybe it's a bioidentical estradiol, which is the strongest form of estrogen, that we provide so that she can kind of have at least some steady level, consistent level of estrogen throughout the month. We might add in a little progesterone, which can also help with those premenstrual symptoms, because it has, especially the mental ones, it can have like a calming benefit. Yeah, so that's just kind of without going into like the initial testing and the additional tests that I would want.
Without being too specific.
Well, I was thinking with the testing, I didn't go into like, what I found on the gut, the GI map gut panel.
Okay, gotcha. So like, let's say you did some more functional testing with like a GI gut panel, like what type of things do you think would show up, and are you looking for on this type of test?
So I'm on that test, I can see specific species in her gut microbiome. So I can see like, are the beneficial bacteria, are they in the right ratio to one another? Are they in the right amount? Beta-glucuronidase, which is that enzyme I mentioned earlier, which is produced by the estrobolome. I can test those levels. Is that too high? If that's too high, that's showing me that there's probably too much recycling of estrogen in her system. I can tell levels of inflammation at the gut level, and higher levels of inflammation, again, are going to interfere with the serotonin production that's going on at the gut level. That's going to interfere with the gut microbiome. And so, we can see how much of a need there is to reduce inflammation systemically and gut-wise. So that in combination with the blood tests and looking at hormone levels, among other things, is it's really good information, at least to start with.
Okay, totally. Before I ask kind of a question going deeper into what you just said, I want to ask a more general question that I think a lot of people are probably hear, but they don't fully understand. Like, what actually is the gut microbiome? Because you hear it all the time online, the gut microbiome, your gut's so important, but like, what actually is the gut microbiome?
The gut microbiome, yeah.
Yeah.
So it's very specific species. They're sometimes bacteria, but they're not always bacteria, but they're always anaerobic, meaning they don't require oxygen to live. So they're anaerobic organisms that are basically living in the lining of your small intestine and somewhat your colon as well, your large intestine. So they're basically these live organisms that we need to survive. They have very important functions. Everything from immune health to actual digestion to hormone metabolism, as we're discussing, to regulating levels of inflammation. So there's a term that I sometimes throw around called dysbiosis, which means it's an imbalance in the gut microbiome. So some of those microbes there's too many, some there's not enough. It's not optimal. We can guess at dysbiosis based on somebody's symptoms: bloating, diarrhea, constipation, and that oftentimes we can kind of be somewhat accurate on that. But unless we do what like the GI map is, or there's another lab that we use where they call it a gut zoomer, which is really looking specifically at a readout of the different microbes. It is basically guesswork unless we do that. It's not something that you're going to see on a colonoscopy. It's not something that Cologuard is going to show you. You really need, and it's not something that the standard stool test that your conventional medical provider is going to order for you when they suspect blood in the stool, or even sometimes a parasite. That's a different stool test. That's often called, it's basically one that's for blood, and then there's one it's called an O&P, which is ova and parasite, and that's specifically looking for parasites. So that's not a comprehensive diagnostic stool analysis.
Okay, so the gut testing that you would get in functional medicine at a clinic like MedMatrix is actually far different from what you would get in a normal doctor's office?
It's much more comprehensive. It does not take the place of a colonoscopy. I send people out for colonoscopies all the time. I think it's one of the best screening tools we have in modern medicine. This does not take the place. It's different. It offers different information.
Please elaborate for those who are just joining.
A colonoscopy is for screening purposes. Now usually insurance is going to pay for it after the age of 45. It's a great screening to rule out cancer. They can detect polyps, precancerous polyps, and those are going to be removed during the procedure if they are detected. It's also great if we suspect that somebody has inflammatory bowel disease. Inflammatory bowel disease includes Crohn's and ulcerative colosis. So again, if there's blood in the stool, mucus in the stool, some really intense pain, a colonoscopy, that's really the way to diagnose those inflammatory bowel diseases. A colonoscopy can show us diverticuli, so these kind of pockets from the colon that can become infected. That's what diverticulitis is. Okay. I'm not going to be able to see any of that on a GI map or a comprehensive stool test. What I can see are inflammatory markers. There's one in particular called calprotectin. If that's high, I'm going to maybe suspect inflammatory bowel disease, but it's not diagnostic.
Okay. And then let's talk about some more testing, because I know a lot of people are interested in that. What about Dutch testing? I think is one of the names for just the more comprehensive sex hormone testing, not just the blood. Like, what's the real, what's the truth about those types of hormonal tests for men and women?
So yeah, so those can be helpful. I don't think it doesn't make sense for every woman to get a Dutch panel just right off the bat. That is testing for what we call sex hormone metabolites, and some of the Dutch panels also test for cortisol metabolites, and another adrenal hormone, which is DHEA. Both of those are made in the adrenal glands, and the Dutch panel uses saliva to test for cortisol and DHEA, and then urine to test for the sex hormone metabolites. So what you get hormone metabolite wise is you get these kind of breakdown products of testosterone, estrogen, and progesterone. And it is considered to be, it is more comprehensive than a blood test. It's often used, we often order it if a woman is having issues with her cycle, she's not having her periods, they're extremely irregular, maybe there's extreme, PMS, infertility, sometimes maybe in that perimenopausal window, but it's also used once a woman is on bioidentical HRT, and we want to see how well she's kind of responding to the therapy, using the Dutch test, especially if it's kind of, we don't really understand why she's not responding as well, or she's having kind of unusual responses to bioidentical HRT. We might order a Dutch panel instead of the standard blood test.
Okay. Gotcha.
So yes, so I guess I would say it's definitely valid. I think sometimes it's overkill, right? Because oftentimes we can tell a lot by the blood test in combination with what the woman is reporting back, what her baseline symptoms were, signs and symptoms were, and now what are her signs and symptoms now that she's been on hormone replacement therapy. And again, to what's happened with her gut health, has that shifted as well? Like, usually clinically we can make some pretty accurate assessments. Okay.
Gotcha. So I'm going to ask a question that might sound dumb, or might be a dumb question.
There are no dumb questions, Cole.
So with estrogen, we're talking about the importance of metabolizing estrogen. What about your other hormones? Do you need to metabolize your other hormones? Like, what happens? The hormones
yes, they all get broken down, right? Like, they're produced, they lock into their receptors, and then they are in the blood, and they need to circulate back go through the liver, get conjugated and eliminated. It's a good question. They all need to go through that process. We don't necessarily see the complications, I guess, that we see with estrogen, right? You don't really hear about like progesterone dominant symptoms or testosterone, like, it just doesn't seem to be.
That was my follow-up question. Was like, okay, so if you're having gut issues and you're not detoxing, and like, what about your other hormones? Like, are you now having issues elsewhere?
It's a good question. I think we don't really see it that much. We don't really see a level of sensitivity to those other hormones. In theory, yes, it's happening. You're not really eliminating the way that you should. I think that I don't know, honestly, like, I don't know. Beta-glucuronidase, for example, specifically is in charge of deconjugating estrogen metabolites. I don't know of an equivalent enzyme for these other hormones. They might be there. We just don't. It's not kind of part of our testing at this point, and clinically, we don't really see issues like we do with the estrogen dominant piece.
Okay.
That I'm aware of.
Okay. All right. Another dumb question coming your way, or possibly dumb. Oh man, I'm forgetting my question. Okay, here it was. So we're talking about detoxing, right? And the importance of having a daily bowel movement in order to detox. Let's say I'm stocked up, right? And I need to detox, and I take a laxative, and I have to take a laxative most days to have a bowel movement. Is that not still effectively detoxing? Like, is pooping while taking a laxative, is pooping while taking a laxative having the same detox effect as just having a normal bowel movement, if that question makes sense?
Yeah, I think it's a good question. So you're not really helping your liver at all, right? You're not really changing the pathways in the liver. So if in terms of the liver kind of doing its job, conjugating, making sure you need like bile. So all of that is important. It's that we call it the hepatic part of the digestion, right? So just taking a laxative is often, there's different types of laxatives, but oftentimes you're just kind of, one form is where you're just kind of forcing muscular contraction of the smooth muscle of the intestine. So you're basically artificially stimulating muscular movement, and that movement. A more common form of a laxative is osmosis, using like basically you're drawing water into the colon, which is then going to make you poop. You could become dependent on it, where basically your own system, the intestines, kind of forget how to do that themselves. And once again, you're not really getting to the root cause of why there's lack of motility. Why is the person stopped up? And so you're not going, yes, you are eliminating, but you're kind of eliminating the final product. You're not really helping the liver. You're not helping the bile production, and the gallbladder is involved in that part. You're not helping, and those detox pathways are happening in the gallbladder and liver. The laxative is literally addressing the very end of the digestive system, just the colon.
So no.
No.
Okay, gotcha. Okay then. All right, guys.
You just wanted a one-word answer?
No, that was perfect. Thank you. That was excellent. Made a lot of sense. All right. Yeah, we've had a lot of people. We've had like a couple hundred people tune in so far throughout the show. We got about just about 20 hanging out with us right now across platforms. If you're joining us now, or you've been with us the whole time, we're gonna have a couple minutes to do some Q&A here. If you want to comment any questions, if you're so brave, we'd love to answer them. But while we're wrapping up here, Dr. Rose, why don't you kind of explain what would a personalized healing plan at MedMatrix look like for someone with estrogen dominance, PCOS, endometriosis, beginning with gut restoration look like, and moving into like hormonal repair?
Yeah, so we start with baseline, right? So we start with some of the baseline blood work that we get right off the bat, and a real comprehensive look at gut health. So I'm always asking everything from heartburn all the way down to, do you have hemorrhoids? So top to bottom of the gut. And then also extensive questioning around a woman's cycling, how she feels throughout the month. Does she have symptoms at ovulation? Again, physical symptoms, emotional symptoms. So really trying to get a real sense. If it seems like we want to do a gut panel, a comprehensive gut panel, we'll do that. We'll get an actual readout of her microbiome, inflammatory markers, et cetera. And then we customize, right? We personalize everybody's plan. So there may be, if we need to help with detoxification, support the liver, maybe we'll do a castor oil pack. Maybe we'll do some botanicals that can optimize the liver's job. Maybe we'll even add in some ox bile, which is basically helping with that step between the liver and the intestines, where the microbiome is. A high quality, nutrition wise, high quality fiber in the diet. I will very commonly prescribe insoluble fiber, even if a woman says she eats, tons of vegetables in her diet. There's rarely negative effects from taking a dietary fiber. These are just examples. And then depending on where she is in her cycle, what, may make sense for her, we might add in some bioidentical hormone replacement if it seems appropriate. We might do some what we call like adrenal adaptogens to help with the anxiety and the stress resilience. We might bring in some help to balance the neurotransmitters. There's some peptides that specifically target neurotransmitter balance. There's, again, we might we always are going to make sure that she's not deficient in vitamin D, B12, iron, magnesium. So pretty comprehensive, I would say.
Yeah. Awesome. All right. Well, we appreciate it. Thank you, everyone. Oh, we got a comment here. This explains me 100%. Well, yeah, it's why we're here. It's what we do. We want to help patients with real healthcare, treat the root cause. I had recently gone my blood test. I don't know if that was with us or another practice, but happy for you figuring this out. Real quick, guys, we do have a special thing for people who've joined us on the webinar. If you book with this live link that I was just commented, you would actually get $200 off as a new patient, and you can book your discovery call through that page. So that just went live for you there. And then, oh, awesome. Yeah, this patient said is with MedMatrix. Well, talk to your nurse and get $100 credit, because I imagine you got a $100 discount, but this one's $200. So see if you can get an additional $100 credit. Ask your nurse. And then, yeah, you can get this $100 discount for another hour, I believe. It expires at 7 p.m. So if you're listening to this live and you want to speak with our team and see if we can possibly help you, definitely click that link and just schedule a free call, see if we can help. And then, yeah, other than that, that is everything for tonight. Dr. Rose, do you have anything to add?
No, I find it such a fascinating topic. And I think like the more that we can spread this information and let women have a different perspective on everything from PMS to acne to perimenopausal symptoms, like the more enlightened women out there, the better.
Awesome. We love it. And more enlightened men too, right?
Yes. Don't forget the men. Yes.
Awesome. I feel more enlightened. So, all right, everyone. Thank you so much for joining. If you enjoyed this episode, don't forget to, share, like, subscribe. We're trying to put out more and more educational content as we go along. And yeah, Dr. Rose, thanks for joining. Bye, everyone.
Thank you.